Children can become ill or injured in an instant, and a hospital emergency department has to be prepared to handle these cases. We spoke with Dr. Ameer Mody of Children's Hospital of Orange County to find out how they handle the most common and difficult children's cases.
So the emergency department at CHOC is a pediatric emergency department, meaning that it's specially geared towards taking care of children's emergencies. And we see a larger pediatric patient population, about 50,000 children a year. I think probably the most common reasons that people bring their children to the emergency department have to do with usually fevers or concerns about illnesses, things like that. Fever is definitely part of almost every emergency department visit. I think when someone comes in with regards to an infection. So fever, is your body's kind of normal response to an infection. So whether or not you have a cold or pneumonia or a serious infection like meningitis or gastroenteritis, fever is going to be part of your complaint. How high your fever is doesn't necessarily correlate with how sick you are. What really matters is what's going on with the whole child, and that's what I really try to explain to parents, is that yes, if they do have a fever and they're difficult to arouse, or they're lethargic, or they're not acting right, or they're having difficulty breathing, if it looks like they're working really hard to breathe, or if they're vomiting and you think that they're dehydrated, those are more important trigger points to me than the absolute number of what their fever might be. So if someone's running around the house with the 103 fever, they're usually not too sick. Especially in pre-verbal children less than 2 and 3 years of age, you have to use a lot of your kind of other senses, and you'll rely a lot on the parents. I take a lot of stock in the fact that when a parent says that my child doesn't look well, or there's something wrong with my child, that means something. That means a lot to me. I'm obliged to find out where that is, and you end up using your kind of other senses. So you end up using physical examination. You have to figure out, is this child crying just because they're cold, or are they crying because they're hurt? When you talk about injuries, injuries are a major part of pediatrics, or injuries and accidents. And so when you talk about things like in the extreme mortality, injury and accidents and injuries represent about 60% of pediatric deaths, of children's deaths before the age of 18. So injuries and injuries are a big part of what we do. We have to be prepared to do anything from a minor scrape on the knee or a little runny nose, all the way to taking care of a child that's in full arrest, that needs an airway, that needs IV access or central venous access, and so we have to be prepared to take care of the whole gamut or the whole spectrum of illness, from a large population that's not so sick to a smaller population that's very sick that requires aggressive interventions. And we're kind of prepared to that, and that's what I was talking about when I talk about the joy of what I do. Is that what I love about what I do is I don't know what's going to come in. I show up to work, and it can be a day where I'll see lots of runny noses, or it can be a day where I'll see lots of kids who are having seizures, or someone who's been a child that's been seriously injured, and I don't know what's going to happen from one day to the next, or 1 hour to the next, and it's fun.